Can you describe what brought you into our office?
Well, I moved to Chicago in 2020, and I've tried 3 different dentist situations trying to evaluate what this pain is from. And so I've had everything done except for Botox before I came to this office to try to relieve the jaw pain that I've had pretty much my adult life.
Can you describe the pain that you were feeling before you saw us?
I've always had jaw pain, but about a year ago when I had my teeth cleaned, my jaw became what I call off kilter. And so my teeth didn't match. And so they made a teeth guard for me, and I started wearing it last October. And when I came to this office, I still couldn't make my teeth completely match and chew food. And I came here, I believe, in March or April. So that's like 7 months. And it came to a head at Christmas time when we were on a Disney cruise, and I had to have my food pureed with my infant granddaughter. So I decided it was time to get this taken care of.
And what did Dr. Brand do for you?
When she came, she confirmed I'd had all the correct dental work done, because that's step 1. And she also said I did the right thing by wearing my guard for 6 months to make sure the inflammation was down as much as possible. So she really had a good base to go on. So she did treatment on both sides the first time. I did get relief, but I will say my hope was higher. But the second time, which I'm back for my third, the second time she did a little more intense on this side, and she did something called needling that I immediately felt the relief from. And this second treatment has left me, in fact, I wasn't even sure if I needed more today, but I will obviously follow the doctor's recommendations. And she said I do maybe want a little bit more on this side, because I can still feel a little effectiveness in my ear area.
And how would you describe how you're feeling? I'm sorry, I already asked you that one. How was your experience in our office?
I'll rave, but I'll probably say the doctor's name wrong because of the way I pronounce English. But I couldn't be more happy. And I had done some research about the Botox, but I have been very hesitant about it because I just really didn't quite understand the difference between the medical uses and the beauty uses. And I really like how she makes the price difference and the approach different. Not that I'm opposed, but I came here in pain, and before I worried about what I looked like, I just wanted to be able to chew food and be able to sleep at night. So now that I've gotten to that level, now I just feel like I look better, and now I am more interested in wearing makeup again and things like that, because I just felt so grouchy, I just didn't feel attractive. So,
Would you recommend us to other patients?
I think that's kind of obvious. But they didn't hand me pom-poms or anything, so we won't do the cheerleading approach. But yeah, I couldn't say enough good things. And I assume it will continue in the future, because I have chosen to go ahead and have all my dental care taken care of here because of the way my jaw is genetically formed. When they clean my teeth, that's when I've always had more problems. So I avoided dentistry because it caused jaw problems, and then my jaw problem. So I'm just glad we can finally hit a balance, and I can be out of pain in both areas. So, and I might get a pretty set next, because God did me this way.
That's awesome. Thank you.